So our first speaker tonight is Bernd Friedlander. Bernd has a bachelor's degree in physical education with emphasis in applied kinesiology, doctorate of chiropractic. He's been involved in developing nutritional therapies since 1982. As a result of his therapeutic formulas, he pioneered the research and use of nutrition and free-form amino acids for improving athletic performance as a safe alternative to steroids. During his career, Bernd has served as a nutritional and sports injury consultant for athletic members of track teams at UCLA, USC, Berkeley, Stanford, and many professional track and field athletes from all over the U.S. He has also worked with professional players from the Los Angeles Rams, Raiders, Clippers, Lakers, San Diego Chargers. In 1984, he served as a chiropractor and a nutritional consultant to numerous members of the U.S. Olympic track and field teams and U.S. Olympic crew teams. Tonight, he'll be presenting on Methylene Blue in the treatment of cancer, aging, and dementia. Please welcome Bernd Friedlander.
Thank you. All right, this is done very quickly under the guidance of Robert for helping me out, and also I want to thank Robert Bound in the beginning, and Susan got me to do this so quickly, so you know I'm going to follow up as much as I can. Methylene Blue is also a new topic for me, so it's not I'm an expert in it, but I got excited about it because I started looking at the research on it, and I started really looking at it with another fellow by the name of Ray Pete, who I think is a valuable person for information. And Ray and I, we probably on the email corresponding a lot, and the guy's a genius. And he was the one that actually opened my eyes to nitric oxide and methylene blue, and he did some brilliant work. So if you have a chance, get his newsletter. It's worth every penny. I mean, it's not a easy one to read. It's technically difficult. Even a lot of doctors have a hard time understanding it. I have to read it through 2 or 3 times to understand it myself, but the more I read it, the more valuable it gets, and it becomes really a genius of a...
Say the name again.
Ray Pete, R-A-Y-P-E-A-T. He's got a newsletter. If you go on the website, I'll show you how to do this. Look up Methylene Blue and Ray Pete, November's issue, and he's got a whole column on it. Okay, and then recently he just came out with another article on how it relates with nitric oxide, et cetera, and that is enormous. But you know, what I started doing is, is it working? Oh, that's, wait, let me do this then. Nope. Oh, here it is. Okay, so, all right. So what I started looking at is more of understanding of these mechanisms, inflammation, NAD, NOS, methylene blue, the epigenetics of everything. I think epigenetics is going to be a very exciting area to look at, how the environment controls us, really. Stress, lifestyle, how we eat, how we think. Even recently, anybody knows it's Huvenga, a scientist who's a molecular biologist, and I have a lot of his books, and I was looking at his books recently, and something really hit me because of these alkalinity waters. And I started reading his science. He understands biology and the anatomy and the atomic levels of how cells work, and that we have to be at 7 point. If we go too far above 7, it can cause disorganization in our body and disturbs the stability of the cell. If we go below 7, it does the same thing. So I started realizing I got into alkalizing water back in the 90s through a former friend who passed away. What's his name? Jim Constant. Yeah, he got me involved with the company. But then reading his book and understanding and talking to a friend of mine at MIT, who's probably one of the most brilliant guys I ever came across, I looked at, and he told me 4 years ago, go into distilled water. It's neutral, it's safe, it's clean water, it doesn't have heavy metals, heavy chemicals. Richard Cunyon believes in it. I spoke about it with Frank Schallenberger. He believes in distilled water. And after understanding that we need to not overdrink alkalinity, it's not good for us, or acidic. And I talked to Raymond Domanium and Gilbert Ling about that, and they agree with that.
Measured where?
Huh?
Measured where?
What do you mean?
pH.
Well, you want to keep the pH at 7 in water, the same thing.
Saliva?
That's a whole different thing, and I'll talk to you about that. There's a whole mechanism of understanding your blood, your saliva, your urine, and there's an RH2 effect that we need to look at. But what really got me interested is all the research that's going on in NAD molecule oxidation reduction, how that is so important, and how cells under these influences, you know, just basically influences everything. So one of the things I got into is looking at reversal of mitochondrial aging with NAD precursors and low levels of NAD, which I spoke a lot last time, and I'm just going to interact that again because I think it's so important. I want you to look at a blog. There's a very important blog I want you to... Anybody knows about the anti-aging firewall? Vince Giuliano. You got to understand who he is. He's a genius. His blogs are enormous. They're valuable. He does research. It's all about NAD and other molecules like mTOR pathways and all that, how they affect us, and also controls aging and diseases. So low levels of NAD as a cause of mitochondrial dysfunction. University of USC is doing a lot of work in that area. I spoke about a year ago with UCSF Blackburn about TCA, or, you know, the telomeres. She says this is more interesting than anything else than telomerase and all that, is the NAD and how we can upgrade it with all the precursors and all that. And I'll tell you some of the things how we can do that. NAD is just a molecule. Inadequate expression of mitochondria-encoded genes are controlled by a cell nuclear factors, NAD, which generates energy, ATP. So you have oxidation, reduction, and all living principles. That's how life works. And it works under low oxygen levels. It's not that we don't have enough oxygen, is that the cell doesn't know how to utilize oxygen correctly, and that's a big factor. And it's due to inflammation, stress, by physical, psychological. It activates hypoxia-inducible factor 1, the primary driver of metabolism reprogramming. Just going to cover this what we did last time. Oxidation of glucose to aerobic glycolysis due to low NAD cannot make ATP, defective electron transport, runs in reverse, produce uncontrolled amount of free radicals, production is increased, pyruvate to lactate. That's how cancer cells generate themselves. And then when the body is under a lot of stress, inflammation, all of that, and NAD levels are low, and I looked at fatty acid synthesis. It should be synthesis. It's really how the cells now utilize oxygen. They don't oxidize glucose anymore because of their metabolism is shipped. They're very hypermetabolic. Okay, their cells become, it's a pregnancy cell. They want to survive. That's what happens in cancer cells. But every disease we know of, cardiovascular diabetes, Parkinson's, Alzheimer's, cancer, is led by these factors, these pathways. It's fatty acid synthesis, where they break down the fats and proteins, and they know how to oxidize that, and that's how they regenerate energy, and they generate lactic acid. So one of the key things that was very interesting is how it leads to these other components, which are tumor-promoting, growth-promoting factors like mTOR and IGF-1. All of these are components of aging. That's why in research today that if you look at all the studies going is driving these pathways down, inhibiting fatty acids. Go into any PubMed right now, you'll see thousands of papers coming on how we can inhibit fatty acids. And Ray Pete has talked about it for 10 years or more about that. And then Richard Miller, who's an MD, PhD, wrote about rapamycin and how that's involved in aging, diabetes, and heart disease and cancer, and how the mTOR pathway is the mechanism that causes these growths. Now, when we're young, we need mTOR pathways to grow new brain, to fill our muscles, to our organs, but at a certain stage, we don't need them anymore, and they're more of a problem than they are good. And then we also want to reduce insulin growth factors because of diabetes and sugars and all of that. Okay, these are some of the things that have been shown to work against blocking fatty acids and also mTOR pathways and things like that. And you know, you got vitamin D, you got niacin, aspirin, you got boswellia, EGCG, blocks fatty acid synthesis, and so does aspirin. If you go back, you'll Google it, and it has a mechanism there. And vitamin D does that too. And then really the key is also improved thyroid function. You know, I've been seeing a lot of cancer patients, as someone here knows about, and one of the things I do is I measure their TSH before anything else. And most doctors don't believe that they have thyroid issues, right? They come in, they all say, my doctor says my thyroid's fine. No. As soon as I give them a simple American biologic thyroid glandular, which is a non-prescription because they cannot get a prescription from their own doctors, it turns them around. And you've seen the people we work with, how much better they got since they got the thyroid functioning. I have 4 cancer patients. They couldn't sleep at night. They couldn't function during the day. Just by switching their thyroid, everything started getting better. And then the other thing is hormones such as DHEA, pregnenolone, and progesterone are very important, and also they also suppress certain things in the mTOR pathway, but also they suppress the nitric oxide, which we'll talk more about that. So one of the big things in NAD precursors, besides niacin, niacinamide, and low levels of tryptophan, is a new product called Niagen, NR, by Chromadex. Now, the last time I gave a lecture here, I had a call from electronic, from I think it's EPH Technologies out of UCLA. He was the head of Motorola. His name is David Estes. Somehow he got online and saw the lecture. He ordered Niagen from Thorne Research, and he started taking it, and he said he noticed an incredible change in his energy, mental function, and sleep. And you know, and his name is David Estes. I know him because he was an electrical engineer who built a lot of equipment for us when we were working with the athletes. And so we look at all the Ks, not just one K, and also look at DCA, which converts lactic back to CO2. And then one of the things is look at all these people I'm talking about. Restriction of tryptophan, methionine, cysteine have all mTOR pathways. They inhibit mTOR. And that's why collagen is devoid of these 3 amino acids. And that's why Linus Pauling has always been a big devote of vitamin C, proline, and lysine. And I talked to Torrey Hagen about it, who worked with Linus Pauling, and he said he was very big in collagen, and he knew collagen was a key component to a lot of his work. Okay. Now we got into another exciting area where, you know, I started realizing more and more that a lot of people are promoting nitric oxide, which is good. We need it, but too much of it is not good. And it's involved in all inflammatory conditions. It's involved by the immune system. When it utilizes white blood cells to kill nitric oxide, it's important. It's used in libido function and all that, Viagra. But it is also a component to stimulate cancer cells through angiogenesis. And there's a whole article, a whole scientific area on how NO promotes blood vessels and promotes the spread of stem cells of cancer cells. And one of the members here who's got advanced stage of cancer who I'm working with, I immediately told her to get on a high progesterone and got into Methylene Blue. All her symptoms, you know, we're talking about, I don't want to mention her because I don't know if you know about what's going on with this one individual. All the symptoms went away. Hot flashes, bleeding, everything. Pain, swelling went completely away. And so it's because we suppress the prostaglandins, we suppress nitric oxide. We also changed the lactate back to CO2, a number of other things, but she's still going to have surgery because she's in the stage 4 of her condition, which is very advanced. And all the doctors are pressuring to have surgery. So, and she's following as much as she can. So many of the tumors arise from infection, and persistent infection, inflammation, leads to autoimmunity, degeneration, cancer, other processes associated with aging. Inflammation fights infection. Inflammation promotes proliferation. Inflammation produces peroxynitrate, promotes gene mutation, demethylation of DNA, rheumatoid arthritis, inflammatory bowel disease, viruses. Now, it also inhibits p53 oncogene and causes mutation. p53 is a tumor suppressor, so you need that. So inflammation and nitric oxide are components that also suppresses p53. There's a whole article on that. Okay, when I wanted to work with simplicity and making it a $5 molecule that you can buy in a fish store that has tremendous benefits on a lot of things, how many have ever used methylene blue for aquariums, right? What does it do for the aquarium? What's the logic to it? It has an antimicrobial, it keeps the water clean for the fish to survive, and it helps with oxygenation. And it goes back to MB goes back all the way back to the 1800s when it was used for malaria and all that. But methylene blue in cancer by controlling the redox state of the cell. That's the key. The reduced state of the cell governing the number of structural fibrinols in the cell and their strength, stress, and reduced glycolytic state stiffens the cell structure. MB plays a role in bringing back the oxidative state, and which governs its shape, behavior, metabolism, and interaction with the surroundings. That's key for fish. They need an environment around them that is healthy. MB can restore respiration cells where the mitochondria has been damaged in many ways. Now, proliferation is increased by nitric oxide, which blocks oxidative energy production. NO activates the characteristics of cancer metabolism, anaerobic glycolysis, creating hypoxia. An excess of NO increases general permeability of blood vessels in cancer, which we talk about angiogenesis, and MB inhibits with vitamin C. Now, also we talked about, you wanted to know about Candida, okay? There's a whole article in Science, if you go on methylene blue and Candida. With vitamin C, it's been very effective to get rid of Candida. There are even bloggers now on the blog talking about their experience with methylene blue and Candida, and they all will tell you that some of them did ridiculous amounts of 500 milligrams, which is extremely high. Ray thinks maybe 1 or 2 milligrams is all you need to get going. Some of the studies I've seen is 5, 10, 15 milligrams for cancer patients once a day. So it's like 2%, you only need a few drops in water, not orally like a lot of these people are doing and getting blue tongues and all that, which we talked about that. So one of the things, again, in excess NO increases permeability of blood vessels to grow, and that's a big thing. MB increases the transendothelial movement of T and B cells and lymphocytes. So they help to organize these cells to be more efficient to attack, as well as to improve our immunity. MB induces apoptosis by NADPH, quinoline, the oxoreductase states of the cells. And that, something like that is really important because, cells are shifting and they're becoming more hyperpolarized in the cell. Now, another thing about, cancer cells, they have a survival mode. And one of the ways they survive is by increasing their glutathione. And that's how they prevent themselves from chemotherapy. That's why all the doctors who are well versed in the oxidative reduction state will not use glutathione in cancer. And they have, like your friend Stephanie, she's big in reducing glutathione, especially in cancer patients, and she's right. Another thing I want to say about Stephanie, she's absolutely right. I've been looking at cholesterol sulfate. How important is cholesterol sulfate? We're eliminating all these important foods in our diet. And the more I read about cholesterol sulfate in the skin and cell membrane and the sun, and how important vitamin D3 is, it's that cholesterol sulfate also reduces inflammation. It's one of the key components to reducing inflammation. And she was exactly right. I read more about that recently about cholesterol sulfate. And you get that from butter, you get that from cream, you get that from coconut oil, you get it from palm oil, but you don't get it from sunflower, sapola, canola, or cottonseed, or all these other polyunsaturated fats. Now there's another article I'm working on right now with Edison Pharmaceutical. They're here, and also there's a group out of Foster City called Gilead. There's a friend of mine working there now. They're now seeing that polyunsaturated fats have major problems in our health, much more than sugar does, because another wrong understanding is that cancer cells drive on sugar. They don't. They absolutely need, the more sugar you give the cancer patient, they recover faster. The more protein they get, they recover faster. There's a lot of articles now that are coming out by Edison Pharmaceutical. They're coming out by UCSF, by Harvard, Philadelphia Cancer Clinic. And Ray Pete has done a beautiful article on how important sugar is in our health. And I forwarded that to Richard Cunyon, Frank Schellenberger, and Robert Rowan. All of them came back and says, you know, that makes sense. They love fat. Cancer cells thrive on fatty acid and protein. That's why you lose weight. That's why you lose muscles. That's why they start deteriorating. They don't have immunity to fight anything. And lactic acid is the major way of blocking immunity. There's a whole study on lactic acid and how it inhibits immunity, so that the cancer cells have another mechanism of protecting themselves besides using glutathione. So one of the things is that you need to look at foods that are very high in cholesterol sulfate. And there's one amino acid that is so important in treating almost every disease, cardiovascular, diabetes, cancer, is taurine. And what is taurine? The only amino acid that has what? Sulfonic. It's a sulfonic acid, right? And I've been really, in the last 2 days, I inundated myself on taurine. I've Googled Medline and PubMed. It's enormous how valuable that amino acid is in protection against glycation. Just glycation, it has one of the properties of preventing aging of the cells, you know, the misfolding of protein. So that's the other way. Another thing very interesting is cancer cells' purpose is to make more cells. That's what their survival mechanism is. So under a lot of stress, under high levels of estrogen, this is according to Acevedos. Hiran Acevedos was the leading researcher at the Philadelphia Cancer Clinic who did 40,000 cultures of cancer cells. He was the head pathologist that everybody sent their cell cultures from their patients. And what he discovered, all the cancer cells had a common denominator at the glycoprotein, which HCG, human choriogonotropic hormone. And a lot of doctors use that for measuring if you have cancer, because if you're not pregnant and you have a high level of HCG, there's something abnormal going on. So if you look him up, you'll see his papers. It's called the hormone of life, is the same hormone of death. You needed HCG to be born with, to reproduce, to have a new fetus, but you also die from it, because that's what stimulates the cancer cells. And also HCG has the same electrical factor as the immune system. It's negatively charged, so it doesn't allow the pregnancy to be attacked by the immune system. And So one of the important things we got to do in all cancers is look at converting the fuel to lactate back to CO2, and DCA is a big one. And so, and methylene blue has that also effect because it deals with a very important complex. Methylene blue helps with complex 4. It's the major pathway that it raises. Now, all Parkinson's diseases, all Alzheimer's diseases, neurogenetics, or any dementia that you're seeing today, cognitive decline, function, is because they're missing complex 4. And one of the major factors that MB has, methylene blue, it actually raises complex 4. And that's why there's clinical studies, and I should be in here, I gave you the clinical studies on MB, and we'll go over that, is that in Oakland right here, they're doing Alzheimer's studies. They have actually seen that methylene blue either suppresses the symptoms of Alzheimer's and Parkinson's, in some cases reverses it totally by two things: by breaking down the amyloid, it degrades the amyloid, but also raises complex 4, which is very important. Oakland, there's a clinic here by Children's Hospital. They did a whole study. I may have it here. I wrote it down, and I think I put it down. I showed you. It should be in the end. I'll go over that. So the inner of the cell is more negative. The cell membrane is actually more positive. Lactate production by cancer cells reduces immune function. Here's all the studies. You can go on there and you can look it up. Cancer cells protect themselves, and it's damaged by inducing an enzyme, GLO1, and also utilizes glutathione from glucose for their metabolism. This is all research right there. So nitric oxide is involved in, it's a free radical gas involved in signal injury. It responds to that. NO is involved in cell renewal, stem cell recruitment. So we need it, but at certain levels we don't need that much. That's why arginine, be careful. I've had too many people with high levels of arginine come to me and having serious symptoms now, and some of these are, you know, muscle symptoms, nerve function, things like that. So that's why we have to watch out how much we take and what is necessary. So NO is involved in all these stress signals, shock, muscle contraction, nerve function, organization of the cell. Too much can cause disorganization. Okay. Adapts to our environment. Epigenetic is involved in inflammation, radiation, oxidation of fatty acids like serotonin, lactate, estrogens, and are signals to respond to injury. Radiated cells and make them more damaged. So NO is produced by white blood cells in fighting infection. Intestinal conditions strongly influence the amount of bacterial endotoxins, influence NO to be produced. So NO too much in the gut, we have issues now with endotoxins which are released, and then we have another serious toxicity load going on. Inflammation is increased. So inhibiting energy production of toxic free radicals leading to inflammation. That's what NO does when it's too much. It inhibits energy production. Obesity and diabetes. NO role in cancer is to promote angiogenesis, promoting blood flow, DNA damage, tumor promotion, and metastasis, and lactate activities, nitric oxide, and other inflammatory mediators. Here's some of the things that I found that seem to overwhelm the nitric oxide, fatty acid, and mTOR is reduce your low carbohydrates, okay? Higher fat ketogenic, meaning good fats. We're talking about butter, cream, MCT, coconut oil, palm oil, those things. Eliminating polyunsaturated fats is important. Okay, when you're depriving glucose, activates nitric oxide. So here's the key. When you're not getting enough glucose, it activates nitric oxide and shifts the oxidative metabolism to oxidation of fatty acid, leading to lactate. This is some of the people, and Ray Peter had a beautiful newsletter on that, not only once, twice, but also several others. Now, urea and uric acid reduces nitric oxide. That's why you remember the way back urea was used for liver cancer and was very successful, and they outlawed it here in the United States, so the people went back to Greece to get it done, or in Spain. That's because it had another. Methylene Blue also helps with that. And B complex, B3 and B1. It has a great protection against inflammation due to the nitric oxide. Then you have thyroid and progesterone. Okay, here's your strong tumoricidals. We just finished the studies with Florida A&M. This is the leading experts in the field, Elizabeth Mazzio and her colleagues. What they found was the strongest tumoricidal against anything out there, against chemo, drugs, anything, out of 35,000 compounds in nature. Your wild yam, Bethroot, all these were frankincense, boswellia, gromrule, gallic acid, caffeic acid. Antiviral, here's your lysine, EGCG, curcumin, okay? These are all the studies she just forwarded to me 2 to 3 days ago. Antimitotics, Spirenskia, the best of all the out there, Spirenskia tea. You can buy it from Calyx, a company called Calyx, K-L-Y-X, out of New York. They have it. Epigenetic stability was folate, B12, B6, choline, biotin, and SAM. LDH inhibitors, Chinese galnut was way up there. Morning Glory was another one. And cinnamon, not only did it come out for LDH inhibitor, cinnamon came out as the highest epigenetics of controlling the effects of genes. The wrong genes getting turned on and keeping the right genes on all the time. And cinnamon was one of the best. Immune stimulant was garlic and zinc. DNA repair was NADH, niacin, and magnesium. This is the studies they have done. They documented it. It's on Nature and Science. And you're the first ones to actually see this before you even went into publication. Okay, so there was one area of methylene blue which, again, it's a simple way to control, the environment of the cells. And we're trying to make things simple instead of going out there and spending a fortune, which a lot of people do. They get overwhelmed with too many things and too many things. A lot of it is lifestyle. Be positive. Enjoy life. Get out to nature. Get some sun. Walk on the ground. Eat organic foods. Eat grass-fed foods. Stay away from polyunsaturated fats. I'm going to tell you that has the highest incidence of damaging our bodies. Go back to nature. All right, any questions? Harvey, you're too old. You can't talk. We're going to make him the oldest man in the world by freezing him.
Okay.
What about lactate production by exercise?
Lactate, that's part of the thing. That's why athletes, we use a lot of potassium bicarbonate and sodium bicarbonate with athletes to rapidly prevent that from happening. A lot of athletes, when we were training them, we actually had them take baking soda before they work out, and it helps. And also magnesium and creatine and all that, and glycine, all those things help. But that's part of it. It is the lactic acid that is due to the change in the respiratory mechanism of the cell and the excessive inflammation. And inflammation, again, is so critical in this area, because inflammation is the starting point, it's the final point, it's everything. And boswellia was #1 on anti-inflammatory. Aspirin, because it has COX-1 and 2 inhibitors. And if you take aspirin, I take it every day, every night, every morning. If you take it with baking soda, it doesn't cause the upset stomach. It actually works well. Now, I will share with you.
How much aspirin?
A friend of mine is an MD, and Ray Pate also told me the same story. His father, had colon cancer, and he was a medical doctor, and he gave his father 10 aspirins a day. He buffered it for him. And in 6 months, it took 6 months, his colon cancer was totally gone. I've told people to do 3,000 to 6,000 grams when it's really critical, and I get stories from people coming back saying, incredible. Yeah, Yeah, 3,000, 6,000, no, yeah, grams is 3,000 milligrams, yeah, of aspirin. But take it with baking soda or take it with a lot of food, you know. And boswellia is good, and so is olive leaf. Olive leaf is very high on anti-inflammatory mechanism, and so is quercetin. Quercetin also is going to be on this also as a list for anti-inflammatory and heat shockers. Yeah.
On the previous page, LDH, what does that stand for?
It's how the pyruvate converts to lactic acid, and instead of going through the proper procedure of making CO2. And so they're looking at inhibitors of that LDH, you know, now as inhibiting that molecule of pathways. You know, the whole thing is we want to get NAD levels back up, okay? Frank Schallenberg is big on this. That's his big thing, is mitochondrial, you know, he talked about niacin and how it raises NAD. There's a lot of research going on in this area of NAD molecule as one of the key molecules that has more significant function in promoting health and longevity than vitamins does, hormones does, antioxidants. This is published now. And that's why I want you to go into the anti-aging blog called Firewall. It's all published there. Huh? It's called Anti-Aging Firewall. Firewall. Look it up. You'll see he's a brilliant, he's in his 80s. The guy is 84 years old. He's like a youthful mind. I'm on the phone with him almost every other day. And he works with a brilliant MD by the name of Jim Watson. Anybody know him in Santa Monica? You were in Santa Monica. You ever met Jim Watson?
I think so.
He's another fellow. And the whole emphasis is controlling that molecule. We control life. We control everything.
The NAD molecule?
Yeah.
Okay.
And niacin and niagen is a big one. That's why Life Extension out of Florida is big. They purchased virtually every manufacturing of the NR from Chromadex.
Is it possible for you to go back to the previous page, because some of the
there's a few things that I had in here that we didn't get in here because, okay, here's one that, you know.
Well, the question I had was about the LDH inhibitors. You have Chinese gallnut, morning glory, cinnamon, and what else? There were some other things.
Let me go. That's the recent that just came out of Dr. Elizabeth Mazzio's group out of Florida A&M. Okay, here you are. Okay. Chinese gallnut came out the highest by far. Morning glory was number 2, cinnamon. And that helps to, the LDH inhibitors also controls epigenetic function, meaning the genes that are expressed incorrectly. And so the head of the College of Pharmacy is Dr. Karem Solomon, and Karem Solomon is a big LDH person. He is huge in that whole mechanism of shifting, you know, the pyruvate function, the oxidation phosphorylation function back to normal, utilizing oxidation of sugars correctly. That's really what it is. And so right there is your biggest molecules right there. Wild yam, since 2002, has been always #1 on her list, and on every cancer. They've done cell cultures of breast cancer, lung cancer, prostate cancer, leukemia, and brain cancer. Those 5. And all these were always, on all 5, came out high without any toxicity level. They will not give you the ones that had high rates, but they had also toxicity. So they're not going to include that until their second paper. So, and they're going to try to modify it. There's one here that's very exciting. She didn't tell you yet. And I'm not going to really divulge that because I signed. There's a compound that they discovered from a seed of a fruit that causes neurogenesis. It can regenerate a whole new neuron in the brain. They looked at 10,000 compounds in nature. None of them did it. Just one compound. It comes from Vietnam and Australia. And now they're going to do a toxicity study before she wants to even talk about it, because the studies were incredible on it. It causes neurons to grow. far outprove anything like lithium or any other ones that also works. And lithium does work in low levels. Make sure you do low levels. 1 to 2 milligrams has safety mechanisms for lowering GSK, which is a major inflammatory thing. Elizabeth Mazzio. You can Google her and you can see, you won't see the new studies on the latest, because it's also when you do get methylene blue, again, start out with just a 2% from cordon. You don't need a lot. 1, 2 drops, see how you do. It has anti-aging functions. It goes back to 1862, where it actually was used widely for malaria. And I don't see the malaria study here, so that's missing. I guess when I send it over to you, part of it didn't show up. Yeah, you have it, right? Yeah, you have. It's in the. I send it all to Susan, and yeah, it's in there. So if you go in the newsletter, you'll see all the other publications, science, and the research on the brain, how it increases, neurons to grow faster. One of the ways through the complex 4, and how it suppresses beta amyloid and helps with other mechanism, nitric oxide, from getting in there and disturbing the function of the brain. Any other questions? So we can go. Yeah.
You suggest taking the methylene blue as a preventative?
There's a lot of research on methylene blue now coming out that it has anti-aging benefits, preventing Alzheimer's, Parkinson's if it's done on a regular basis. They've used it with some concussion issues with athletes and concussion. That's a new one that a friend of mine at the University of Tennessee is doing right now. I can't talk about it because that's something they're working on, but I will tell you once he's done with it, yeah. And like I said, you don't need much. 1 or 2 drops seems to be very efficient, and I would do it in distilled water myself. 8 ounces of distilled water, 1 or 2 drops.
Bernd, can you give us a supplier for this, or should we just go to the aquarium store?
Yeah.
Really? It's
Amazon,
the same thing?
Go to Amazon. I don't even get involved with that.
So there's not a human
I'm not
grade?
in sales of that. I don't want to get in trouble. Amazon sells it for $4 or $5. It's 2% cordon, K-O-R-D-O-N. And that seems to be, really cheap. And as a matter of fact, somebody went to PetSmart the other day and they got some there. John McIntyre, he's not here. And that's the other guy you guys need to know. What Steve said about the plates, he's right. John has a beautiful setup in San Carlos. It's free. You just walk in there whenever he's there. You can use his facility for free. And he's got the plates. He's got lasers. If you want cosmetics done for free, he will do it for free. And if you got pain, it's free. John McIntyre, who's always sitting here, the guy knows about lasers. And he has the whole setup, right? And if you want to, you can set up appointments with this young lady. Raise your hands. And she will set you up with John and her to get a full treatment of everything. He's got it all. And it has to be what they sell. Like, no, it doesn't have to be food grade. It's got to be aquarium, where they have an aquarium. Yeah, yeah. Anywhere that has a fish or something. Okay,
Bernd?
No.
Bernd?
No, we can do it after Steve.
Bernd, I spent days researching every article I could find in methylene blue and everything I could find everywhere, and days trying to understand it. But when and a lot of the stuff that you said I found, but on the brain stuff, it seemed equivocal, and most of the research came from a group called RX Tau, which is making some kind of pharmaceutical form of methylene blue. So I just didn't find it, so maybe the research hasn't been done yet.
No, I'll show you the clinical studies that came out of Oakland. I forwarded that, and it had the clinic and the head researcher there. Yeah. No, that's where also Ray Peat found it there, too. He also uncovered studies on methylene blue and depression bipolar, that they reverse bipolar with it.
If you have questions, please wait for the microphone because the people at home can't hear the questions.
I think we are fine.
What's the SAM you had up on the list of, is that SAMe?
Yeah, that's SAMe, yeah. Put this on. Okay.
Any other questions?
We can do later.
Okay. All right, so we're going to
Thank you.
take a 15-minute break, and then we'll